During my visits, I always feel we need more appointments in the evening because just because it's people with learning disabilities, people have their daycare centers, they have their part-time jobs, they have various activities in the morning. So more appointments should be given out early in the morning or late in the afternoon. The barriers which most patients with learning disability might have is understanding what is an annual health check. So they might get a text or a call saying that you have been booked for your annual health check, but they might struggle to know what an annual health check is. So the best fix would be if the GPs are sending a letter to make sure that they are sending an easy read guide with them. MenCap does provide an easy read PDF template which can be easily downloaded, and a copy can be sent along with the letter which they are doing.
So a big thing that I come across a lot, one major reasonable adjustment that GPs can make is about waiting rooms, waiting times. A lot of the time a GP waiting room can be really noisy, lights can be quite overbearing, there can be noise going off, there could be children crying. If there is a quieter space in a GP to put somebody who might be overwhelmed with sensory stimulation like that, to have them in a side room works really well, or just say, you know, you can stay outside until I call you, and then they're out in the fresh air, they're not listening to the noise, and then they'll be much more inclined to stay and actually attend the appointment. Something else that is a really important thing is making sure that easy read letters are given out where available. So it should be recorded on somebody's notes what communication aids that they need, whether that is verbal, whether that is easy read. That should be recorded, and they as a legal requirement should be followed to make it more accessible for people.
Going to GP surgeries, we should encourage them to make sure that they get all people with learning disabilities to come for their annual health checks. If they are struggling with invalid numbers or with support or with hesitancies, then they should make sure that every option has been met before giving up or putting that person on a decline list.
So from researching around Sheffield, working with GPs, a lot of people the clusters did not attend, and that was not brought because maybe they're dependent on carers to bring them in who didn't get the letter, or it's a carer who doesn't necessarily know the importance of the appointment, or it could be somebody who lives by themselves and they can't read a letter that they've received, or a GP might have a text message service, and if the person themselves can't read the text, then they can't respond. It may then get classed as did not attend, and then ultimately they miss a really important health check that they need every year.
They could give the patients a bit more information on what days they have it and what can and improve it by just letting the carers or the family know when it's due.
Quite a common feedback that I get when I'm speaking to people with learning disabilities across Sheffield to do with their health is that the doctor or the nurse, whoever they're seeing, doesn't speak to them. So say they go with a carer or support worker, the information gets directed at their support worker, which can often make the person themselves feel as if they're invisible or they're not important. And so it's really important that information is shared with the person themselves. But, you know, these are people. At the end of the day, they want to be communicated with just like everybody else. If that information then needs relaying to the support staff, absolutely, that can be written down or whatever format it needs to be, but communicating with the person as you would with everybody else.